Hello, and welcome to an episode of the Footstep Show. My name is C. Today we'll be talking about stroke prevention. And today I have a guest all the way from USA, Dr. Ammah. Welcome.
Hello. Hello,
How are you
everyone.
doing?
I'm doing well, thank you.
Good. So who is Dr. Ammah?
So, so I'm actually from Silver Spring, Maryland. I did my medical school at Howard University, and then I went my training in neurology at University of Maryland in Baltimore.
Great. So what is a stroke? I know we're talking about stroke prevention, but what is a stroke actually?
So a stroke is basically any condition that actually affects the blood vessels involving the brain. So anything that can cause decreased blood supply to the brain itself, leading to an injury to the brain, we will consider that to be a stroke. There's different types of a stroke. There's what we call a hemorrhagic stroke and an ischemic stroke. So basically a hemorrhagic stroke is when the blood vessel bursts and causes bleeding into the area of the brain. Whereas an ischemic stroke means that there's decreased blood flow to the brain itself. The thing about stroke is that it can cause significant amounts of morbidity, meaning disability, and also mortality as in death. So it is actually a very important topic to discuss.
All right. So I know you spoke about the different type of stroke, but can you go into more details of the two types of stroke?
Yes. So basically, we divided out into the bleeding strokes and the non-bleeding strokes. So for the bleeding strokes or the hemorrhagic strokes, those are the ones where people might have, like they say, I have an aneurysm, a rupture, meaning like they might come in with a very severe headache and it feels like something literally burst inside of their head, and then all of a sudden they're unable to do what they were previously able to do, depending on where the bleeding actually occurred in the brain itself. So that's one type of hemorrhagic. Then there's the one where just the area of the blood vessel just bursts into a small little area of the brain, which can be due to high blood pressure and uncontrolled high blood pressure. Then there's other different types of strokes where it's basically decreased blood flow to a certain area of the brain. So such as something like you have a clot in your heart or in the arteries of your neck that then goes to the brain and causes a shut off in the whole blood supply to that particular area, and then people will be able to do whatever that area of the brain was designed to do, such as you might have weakness on one side of your body, numbness or tingling sensation on one side of your body, or things of that nature. There's also the difference between what we call a venous stroke, meaning it's a problem with with the actual veins as opposed to the arteries, and an arterial stroke where the issue is a problem with the actual arteries in general.
Question would be, which one is the most common one when you have patients with stroke?
The most common one is worldwide is what we call the ischemic stroke and arterial stroke. So that's the one where a clot breaks off somewhere and then it blocks off the blood supply to a particular area of the brain. So that's the one where you don't have any pain at all, no headache, no nothing. All of a sudden you just can't do any particular function. So you might have a drooping face, dragging your leg, just confusion, you're not able to speak, or like you're having significant vertigo where the room's just spinning around continuously.
Wow. So I know specifically like how many, like one, is it 1 in 10, 1 in 20 that a person will get a stroke? What is the the scientific numbers of people that have stroke in the around the numbers, the figures?
The figures. So for at least for US, it is the number one cause of modifiable
Okay.
disability in the country, number one. And
Wow.
then in terms of death wise and significant morbidity mortality is number five. So this is basically looking at all the different populations, but of course there's certain populations that are more prone to having strokes than others, and more who are more likely to develop actually end up having significant disability or even death after a stroke. So it's one of the things that is caused so significant amount of disability and death, but is so preventable, which is why I went into this particular field.
Wow. It's scary actually to know the US is the number one thing there. Wow, it's very scary. So what are the, I know
Mm-hmm.
you touched about the signs, but can you go into details? What are the signs of stroke that a person must see if like a family is like watching TV and then something happened? What are the signs to look for?
Yeah, so there's actually an acronym called B FAST. So B stands for balance. So if all of a sudden somebody's not really walking straight, like if they're walking as if they're drunk or intoxicated, all of a sudden. The other thing is E for basically the eyes. So either loss of vision in the eyes, or the eyes are, you have like double vision and one eye's drifting off to another place where it shouldn't. F is for face, so like facial droopiness. A is for arms, so you actually want to check to see if one arm's drifting and compared to the other. S is for speech, so either they might sound very slurred, or just like their speech is very garbled, or they cannot communicate at all. They cannot get any words out. And then T is basically time. So if you see any of those different things, you need to call emergency services immediately. There are other things that are not listed in this acronym, but people should still be aware of, and that is basically if somebody's just confused and they have significant amount, their memory has dropped significantly in a very short period of time, as opposed to like somebody with dementia where it's like a long-term thing. But if 1 minute they're remember things just fine and able to hold a conversation, but then there's a sudden change, that is also a warning that they may be having a stroke. The other thing is vertigo. So vertigo can be like something like an inner ear pathology where you see spinning sensation, or it can actually be a sign of a stroke. So if you have sudden onset of the world just spinning around and you feel very nauseous, feel very sick, that also might be a sign that you might be having a stroke.
So sorry, we had some technical difficulties. So sorry. So we apologize. It's one of the things when we do a show when we run into difficulties. So we're so sorry. So welcome back, Dr. Ammah.
Oh, thank you.
Yes. I know we were talking about the woman. So what are the risk factors for stroke?
Oh, yes. So there's quite a few different risk factors. So some of them include what we call modifiable risk factors and non-modifiable risk factors. So modifiable risk factors are things that we can do ourselves to help prevent us from having a stroke. And then there's things that we have no control over. So these are things, the first set of modifiable risk factors are things that like a doctor can look for, and that's high blood pressure, diabetes, high cholesterol, obstructive sleep apnea, which is basically when somebody is sleeping and they might snore or gasp for air when they're sleeping. That's also a risk factor for stroke. The other thing is smoking. Drug use is another modifiable risk factor. Other things that's more of a lifestyle change that we can also adapt to or actually have that makes us more susceptible for stroke is being overweight increases your risk for stroke. Not exercising regularly increases your risk for stroke. Having a poor diet increases your risk for stroke. And not maintaining a good weight also puts you at risk for stroke. So you can be very slim but eat very poorly and you're at a high risk for stroke. Similarly, you can be somebody who goes on and off of various different diets, and because it's not a consistent thing, that by itself also increases your risk for stroke. So those are what we call the modifiable ones. Now, the things that are non-modifiable risk factors are the things we have no control over. And that includes age. So as everybody gets older, the risk for stroke goes up. Your race. So people of African descent are at higher risk for stroke than others. Then there's genetics. So if you have family history of stroke, that increases your risk for stroke. And certain genetic conditions such as sickle cell disease also increases your risk for stroke. The other thing is that if you are prone to having, if you have a family history or you yourself have a history of any form of like autoimmune disease or like any condition that's that you may not think is necessarily related, but say you've had multiple miscarriages, that might be a sign that you might also have a stroke at an early age than, say, others, such as you might have a stroke in your 30s as opposed to in your 70s.
We'll be taking a commercial break and we'll be right back.
Are you an African parent who is looking to engage your child in an educational program? AfriCanada Hub is a non-profit organization that aims to elicit the creative and leadership skills in the Black child. Register your child today in our ongoing book clubs and leadership programs by calling or texting 416-939-0530 or by visiting our website at www.africanadahub.org. AfriCanada Hub. We are all capable.
Go show me from a book, oh, sumo. Oh, a book from no.
right, so welcome back. Sorry again for technical difficulties. It's very cold in Canada here, so the lights are going on and off. And unfortunately, it happened to me that I have no light. I'm so sorry about that. So if you're joining us, we're live on Facebook, YouTube, and don't forget to follow us on Instagram, Twitter, and Facebook and YouTube, as well as the Footstep Show. So we are talking about stroke and to prevent stroke happening. And we have our guest, Dr. Ammah, all the way from the US. Welcome again.
Thank you.
Yeah. So I know you were talking about like the signs, like the warning signs of the risk factors involved. But what about blood pressure? Would that be a sign as well to look out for?
Yes. So people with high blood pressure are more prone to having strokes than people with normal blood pressure. So if you are at home and you're checking your blood pressure and you're normally, even if you have high blood pressure, under relative good control, then one day your blood pressure is starting to creep up, and you're not feeling right. Also might be a sign that something might be going on and you should seek immediate medical attention. The reason being is that when one, high blood pressure increases your risk for stroke. Two, when your blood pressure is going higher, it might be a sign that your brain is saying, I'm not getting enough blood, I'm not getting enough nutrients, so it's driving the blood pressure up. So very commonly, people who come into the hospital, their blood pressure, the top number is in the 200s, the bottom number is in the 100s, which is actually extremely elevated, but it's a sign that their brain is starving for nutrients. But at the same time, if your blood pressure is running that high, that might be a sign that your blood vessels might give out on each other and basically burst and cause a bleeding. So having high blood pressure that's uncontrolled is a bit of a concern, especially in regards to the brain.
So what happens if you think that like a person has stroke? What are these steps? I know you spoke about B5, but let's say someone's alone at home and they think they have a stroke. How to go about it?
They will need to seek immediate medical attention. So for US, we call 911. Elsewhere is basically whatever the emergency service line is, or finding somebody outside that can get you help, or calling someone that can get you help immediately is the most important thing, because it can lead to death. And that's why it's so important that as soon as you notice something that is off, you call immediately.
Once, I'll use an example, my godfather had stroke and he was able to recover, but he had some mobility issues right now. So what are the common treatments for one person, like my godfather that came back, was able to come back and have some treatment going on? So what are the common treatments that a person that has stroke can do or can have from the hospital?
Yes. So with the stroke, there's clot busting medications that can be given within the first 4.5 hours. Well, for US, everywhere, depending on the world, the timing is a little bit different. But for US, first 4.5 hours, you can get a clot busting medication, and that has been shown to basically dissolve the area of where the actual clot is, so that way the blood can get around that particular region. So that's something that can help in terms of reversing things if people seek medical attention immediately. The other thing that can happen is something called endovascular, meaning that what happens is that the interventional radiologist or the surgeon will take a catheter and they will go all the way up to the brain, to the arteries of the brain, and pull out the blood clots, so that way the blood can flow normally. That can be done within the first 24 hours of symptoms if the clot is something that can be retrieved. And every stroke, sometimes there's not a big clot that they can be pulled out, but that is something that can be done if people come in immediately. So that's why we always say call 911 or call emergency services immediately, because there's things that can be done right then and there to prevent the damage. However, once somebody is infarcted a territory, or what we call had completed their stroke, there's not much can be done to that brain. That means that the brain is already dead and it's not going to come back. However, there's other areas of the brain that can learn the functions that was previously lost. So that's where the rehabilitation comes in. So physical therapy to help you in terms of your strength and your mobility and getting around is important. Occupational therapy is also important in terms of doing your activities of daily living and how do you get from one place to another and things of that nature, and those fine finger movements that people might have affected after a stroke. And then speech, because sometimes people have a stroke and then their speech might be a bit slurred or they to communicate as well as they previously did. So the therapy is extremely important, and people who can recover after a stroke, they recover most within the first 3 to 6 months. They might recover a little bit more from the 6 month to 1 year period, and very slightly from the 1 year to 2 year. Once you hit the 2 year mark, that's pretty much where that's your new baseline after the stroke. So that's pretty much where we do the immediate intervention, rehabilitation in terms of the recovery. Then the next step is this, what we call secondary prevention. So you might not have been able to prevent the stroke from happening to begin with, but the neurologist's most important thing for us to do is find out what was the underlying cause of this person's stroke and what can we do to prevent it in the future. Because one of the things that increases your risk for strokes in the future the most is having a previous history of a stroke. So these are things like different medications, such as an aspirin, or another blood thinner called clopidogrel or Plavix. These are what we call antithrombotic therapy or antiplatelet therapy to help thin out the blood, so that way you can have continuous blood flow, especially in people who have history of high blood pressure, diabetes, or high cholesterol. The arteries have already shown signs of change, and basically starts to have some narrowing in those arteries. So when you're on these different blood thinners, it can help the blood flow to the brain with more of the ease. Then there's more potent blood thinners called anticoagulation, such as warfarin or Eliquis or Pradaxa or Xarelto. These are medications that are given to people who have underlying heart conditions, such as something called atrial fibrillation, or they have a blood clot that's sitting somewhere that actually led to their stroke. So being on these blood thinners can help prevent future strokes in the future.
All right, so I know I'm gonna use my godfather as an example. I know he's like he can only move from waist up and not waist down. So what can cause that, like a bit paralyzed because of the stroke has hit him very hard? So what happened? Because I've seen that like when we go visit him, we see that like the foot are swollen because of the blood. The blood flow is not enough. So what do you tell people who are like paralyzed from waist down what to do when after the stroke had happened they're on the road to recovery?
So that's a very good question. So there's a few different things. So when you're at that particular stage, one of the most important thing is that it's movement. So even if you cannot like move your limb yourself because it's paralyzed, having somebody move your legs is extremely important, because you don't want the blood to pull in the legs too much, because what can happen is that you're more prone to having blood clots, or you're also more prone to actually having what we call venous stasis, or just basically swelling in the legs, and especially in the lower part of the legs, because you're not moving it, and that can lead to multiple other different issues. So having a family member, or if possible you yourself, trying to adjust yourself and moving those extremities and having it elevated is ultimately important. And also, especially people who are paralyzed waist down, moving and adjusting in terms of different positioning, because if you're laying in bed on a basically a flat surface, you're more prone to getting sores, because if something is touching a surface for a long period of time, the skin might break down. So doing that adjustment is important, and there are different medications that can help people if they become very stiff. So when somebody has initially, they're just not able to move it and is just very limp. But after a time, it actually can become very, very stiff and what we call contracted. And then it's very hard to even straighten it out or adjust it or anything along those lines. If that occurs, then it can be very painful for the person. So making sure stretching and having various different therapies is extremely, extremely important in terms of recovery after a stroke. And then especially making sure that there's no blood clots and things of that nature is also important, especially if they're paralyzed waist down.
Yeah. And I also realized that, like, during the road of recovery, they had to, like, do an operation on the throat for him to be able to breathe. And why is it so? I'm
So,
curious to know why it has to be, like, operation on the
why?
throat for him to be able to breathe. Yeah.
Yeah. So it sounds like he had a pretty extensive stroke. But the
Yeah,
thing
it's
is
good.
that the thing the brain is the powerhouse for the entire body. So your lungs
Mm.
can work perfectly fine, your heart can work perfectly fine, your muscles, your bones can be completely normal. But if you have a stroke, the main computer basically shuts down. So if the main computer is saying the breathing center is not really working, somebody might not be able to breathe on their own, or they might not be able to just do things that you have absolutely no thought of doing, and that can just be taking a breath or swallowing and things of that nature. So when you have an extensive stroke, especially when it's around what we call like the brainstem area, where all of the very central information takes place, if that area is lost, the body will eventually recover if you give it enough time. However, in the immediate phase, they have to have the breathing tube put down their throat, and that's not like a permanent thing, because that can cause a lot of issues. It can cause a lot of damage if it's through the mouth and down the throat. So what happens is that people might actually have to have a tracheostomy, where they put the breathing tube right in their neck. And when they do that way they can get the oxygen, get all the air that they need for the body to continue to function. However, all of this area here, the musculature is just not really working too well. So that's why they have to go down here. So basically get the oxygen to the lungs directly from that mechanism. Also, and a lot of times people who have a significant stroke, they might actually have to get a feeding tube. So when they're in their hospital, they might lose the ability to swallow safely. So they might have like a tube that goes from their nose down to their stomach. But later on, of course, that's not like a permanent solution. They might have to get something called a PEG tube or a G tube, where the tube goes straight into their stomach or into their intestines, and that's how they get their nutrients. As time goes on, they may recover, and then you can remove the actual tracheostomy tube, remove the feeding tube after some time, and once it's deemed safe for them to breathe on their own and swallow on their own without any issues. So it's usually because of they're not able to protect their airway because the musculature
All right, welcome back. Um, there's a lot going on, like a lot of cold season going on in Canada and in the US. So it's affecting the connectivity and the network issues. So it won't be long. So we'll be right back. All right, so welcome back, Dr. Ammah.
Thank you.
Yes. So I have some questions from the viewers. One was asking, what is the best age for men and women to start taking baby aspirin?
So there's been a lot of debate in terms of taking baby aspirin for just basically primary prevention for whether cardiovascular health, heart conditions, or stroke. There has not been, based on the various different studies, it has not been shown that people need to take it on a daily basis at this particular time, unless you've already had a heart event or a brain event of some sort. So right now, the recommendation is not to start unless you have a clear reason to be on it, because of the risk that kind of goes along with taking an aspirin every day.
All right. Second question that I have here from a church viewer is, it is advisable for pregnant women or breastfeeding mothers to take aspirin?
For people who have preeclampsia, and they're pregnant and they have preeclampsia, that's the time that to actually take a baby aspirin, while they're, the OBGYN, the high-risk OBGYN is monitoring them. Other than that, it's not recommended to take a baby aspirin unless you have like an underlying heart condition where you need to be on it.
All right. Okay. Thank you so much for answering the question. So yes, like you said, my godfather actually had like a very excessive stroke where he had to, like you said, he even had feeding tubes from the stomach to be able, but he was able to recover. But the only thing is that he's like paralyzed from waist down, and I've seen that we try to help to lift because now he was all alone, and now he's okay. He's doing okay with the help of like the medical officers and the team that we are grateful to, so they help him a lot. And I've also realized that sometimes they have to get a bigger shoe because it's very swollen. One like on the foot, we saw that was very swollen. So what causes that? I know you said the blood flow sometimes, but we've seen that at some point we have to go by like an extra like 2 times the size for the shoe to go in because you don't want to get the feet cold, right? So what causes that as well? One of the feet.
Yeah. So the swelling of the feet, so that could be due to multiple different things. So one is that just the not being able to move it too much. So the blood flow is just pulling at the bottom of the feet itself. So elevation can help with that. However, some people, they might have an underlying condition that led to them to having a stroke, such as a heart condition or a kidney condition, and that causes their legs to swell significantly. And because their legs swelling, and of course their feet will also swell to the certain points as well. So it might be the stroke in terms of not being able to move it, or the underlying condition that led to the stroke.
In all, how do we know our stroke risk?
So The thing is that we all have a risk, and the thing is that we have to look at our own bloodline. So one is that if you are of African descent, your risk is higher. If you have family members, especially if they're direct or their grandparents, aunts, and uncles who have had a stroke, you yourself should know that your risk for stroke is higher. And then the other thing is that if you have an underlying genetic condition, especially sickle cell disease, that makes you at a higher risk. So these are things that make you higher risk for no matter what age. With sickle cell, autoimmune conditions, and previous history of miscarriage makes you at a risk for stroke with at a young age, so in your 30s. If you are a smoker or you use drugs, that will also increase your risk for stroke at a young age, so stroke in their 30s as opposed to, say, 70s, 80s. And then, of course, if you are elderly, your risk of stroke is higher because as you get older, your risk for stroke goes up each day.
And lastly, how can you prevent strokes? Like, let's say someone has stroke, but it's going to reoccur. There's reoccurrence. So how is it possible to prevent all this happening?
Yeah, so there's something called primary prevention. So before you even have a stroke to begin with, that is exercising regularly, eating a well-balanced meal, maintaining a healthy weight, making sure you don't engage in any illegal drug use or you don't smoke. And just those are the things that will help you just in general. And if you have high blood pressure, high cholesterol, or diabetes, making sure that you exercise regularly, eat right, will just drop those things so you don't have to be on those medications. So that's why no matter what condition people have, they will say, oh, exercise regularly, eat right, because that's the thing that will help prevent all of the other different things down the line, because it will help with diabetes, high cholesterol, and high blood pressure. There's people who have a genetic predisposition for those things, but if you counterbalance it with those different lifestyle modifications, your risk will drop down.
All right. Thank you so much. And your last message to our cherished viewers who are watching us to prevent stroke.
So most important thing is knowing your risk factors and making sure you live right, do the right thing. And if you have anything that seems a little bit strange, call immediate medical attention as fast as you can.
All right. Thank you so much. On behalf of myself and the entire Footstep Show, I want to say thank you so much to talk to us about stroke prevention. Actually, viewers have learned a lot for this great topic about stroke and how to prevent it, and to help their friends and family members to know about it too. So thank you so much. It was a pleasure to have you. So thank you so much.
Thank you.
Thank you. All right. So that's it for today, cherry viewers. Don't forget, this month is our 2nd year anniversary of the Footstep Show. So if you have anything to let us know, videos or messages, please do send it on our platforms and we'll read it out loud anniversary. So thank you so much. We are sorry for this network and technical issues. It happens. So we want to say thank you so much for sticking throughout this show. So have a great, enjoy the rest of the weekend.